Hi everybody, it is Chrissy and I'm back again with another video about cleft lip and palate for Cleft and Craniofacial Awareness and Prevention Month. In the first video I talked about what is a cleft lip and palate, and my second video about the causes of it. And today I want to talk a little bit about the diagnosis and some basic treatment. So first of all, cleft lips in particular are generally diagnosed during a routine ultrasound. They can see it on the ultrasound pretty easily, and so that's that first layer of diagnosis. The next layer would be at birth, when they obviously if it's a cleft lip and they can see it, and they can also inspect the mouth and they can see that the break in the cleft in the palate. There is, however, one type of cleft palate that is not visible and is often diagnosed later in life based on the symptoms that somebody presents, and sometimes is often later in life, so they go into adulthood with it. And this type of palate, cleft palate, is diagnosed based on symptoms like difficulty with eating, feeding, swallowing, and liquids coming out of the nose, a nasally voice, and chronic ear infections. As for the management and treatment of cleft lip and palate, the first step is surgery early in life. For a cleft lip, it's generally done around the first few months. For myself, it was about 4 months. And then for a cleft palate, it's done a little bit later, but generally before 18 months. And that is because they want to get children onto regular eating habits and also get them speaking, because particularly the palate can affect the ability to speak, which is something I'll talk about in another post. And so as we go later into life, there may and many times there are additional surgeries that are done, and these are done to improve appearance, hearing, speech, breathing, and language development. Additionally, most patients with cleft lip and palate end up having a lot of dental and orthodontic work. I've had orthodontics or braces twice in my life, which is not terribly uncommon, and is also quite expensive. But that's some basic things that are done to repair and give a cleft lip and palate patient a normal life. Thanks, and I will have another video up soon. Thanks for listening and learning about clefts.